Vitamin D is essential for our bodies, especially when it comes to bone and muscle health. It helps regulate calcium and phosphate, which are crucial for building and maintaining strong bones. Most of our vitamin D comes from sunlight, but factors like age, skin type, and limited sun exposure can lead to deficiencies. In older adults, vitamin D deficiency is common and can increase the risk of fractures, falls, and musculoskeletal diseases. That's why experts recommend supplementation, especially for those at higher risk. The recommended daily dose varies, but for those with increased risk, 1000 IU per day is often advised. Understanding the importance of vitamin D is the first step in preventing serious bone and muscle problems as we age. Not everyone gets enough vitamin D from diet and sunlight alone. Older adults, people with darker skin, those who spend little time outdoors, and individuals with certain medical conditions are at higher risk of deficiency. Studies show that vitamin D deficiency is widespread, affecting millions across Europe and North America. In some groups, like ethnic minorities in northern countries, the risk is even higher. Factors such as higher age, higher body mass index, use of walking aids, and limited outdoor activity all contribute. For these populations, supplementation is not just recommended, it's necessary to maintain healthy bones and muscles. Public health strategies also include food fortification and encouraging safe sun exposure, but supplements remain a key tool for those most at risk. Research on vitamin D supplementation and its effects on fractures and falls has produced mixed results. Large studies in healthy vitamin D-replete adults often show little benefit. However, in people with low vitamin D levels, especially the elderly or those in care homes, supplementation, particularly when combined with calcium, can reduce the risk of fractures and falls. The most effective doses are typically between 800 and 1000 IU per day. High or infrequent bolus doses, on the other hand, may actually increase the risk of falls. The key takeaway is that supplementation works best for those who are deficient, and the right dose and regimen are crucial for safety and effectiveness. Osteoarthritis is another common concern as we age. The relationship between vitamin D and osteoarthritis is still debated. While vitamin D may not prevent cartilage loss or radiological progression of osteoarthritis, some studies suggest it can help reduce joint pain and improve function, especially in those with low vitamin D levels. Supplementation with 802,000 IU daily has shown modest improvements in pain and function in clinical trial. However, the benefits are most apparent in people who start with low vitamin D. For those with adequate levels, extra supplementation may not provide additional relief. This highlights the importance of assessing vitamin D status before starting supplements for osteoarthritis. Safety is a top priority when it comes to vitamin D supplementation. Daily doses of 800-1000 IU are considered safe for most adults. Higher or infrequent large doses can increase the risk of side effects, including falls and bone loss. Some people, such as those with malabsorption, obesity, or liver issues, may need special forms like calcifediol for better results. In certain situations, a loading dose may be used to quickly correct severe deficiencies, but this should always be done under medical supervision. Ultimately, the goal is to achieve and maintain optimal vitamin D levels without exceeding safe limits, ensuring the best outcomes for bone and muscle health. Conclusion: vitamin D is vital for musculoskeletal health, especially in older adults and those at risk of deficiency. Supplementation is most beneficial for people with low vitamin D levels, helping to reduce the risk of fractures, falls, and possibly joint pain. The recommended safe dose is 800-1000 IU per day, often combined with calcium for maximum benefit. High or infrequent doses should be avoided due to potential risks. For certain medical conditions, specialized forms or loading doses may be appropriate, but always under a doctor's guidance. Maintaining optimal vitamin D levels is a key step in supporting healthy bones and muscles as we age.